So welcome everyone to our webinar this afternoon. It's for the Early Development Instrument. The title of the webinar is A Community Level Index of Children's Health, Development, and School Readiness. We thank you for taking time out of your busy day to learn more in regards to the EDI instrument. So for our agenda, we will go over the purpose and overview in regards to the Early Development Instrument, the various domains that comprise the instrument, reporting. As many of you may be aware, we did do this last year, so we do actually have some of the data, which we will be able to share with you this year in regards to the results that we have collected so far, the roles of our key partners in the EDI administration, the student confidentiality. So for each LEA or school that participates, you will actually receive a school level report with information specific to your school, which is confidential to your school. So that information you will be receiving as well if you do decide to participate. The 2016 EDI results, so we do have some of our maps in regards to the domains and the vulnerabilities of students in DC, the timeline in regards to participating, and then lastly, the next steps if you do decide to participate. So this time I will go ahead and hand it over to Lisa.
Great. Hi, everyone. Hi, Darrell and Jocelyn. You're there. Nice to be on the call. My name's Lisa Stanley. I'm from UCLA, our Center for Healthier Children, Families, and Communities, and we run the National Support Center in the United States for the Early Development Instrument, or the EDI. And so we've had the privilege of partnering with OSSE and the DC community to implement the EDI and to support the great efforts you've already have underway to use this data to support well-being of young children. So I'll go ahead and give you a little bit of background, and then Darrell and Jocelyn, you can guide me in terms of when I should pause and if there's an opportunity for folks to ask questions. I know that the audience is on mute right now. Is that correct?
Yes. Well, once we get to the end, we'll unmute so they can do question and answer.
Great, great. And also, I have some of my technical people on my team listening in. So if we do get any technical questions about data sources and things, I might ask you to unmute for Josh or Emily.
Okay.
Great. Thanks. So just a little more background to help orient you to the EDI. It is different, I think, than what some folks, particularly within education sector, are used to in terms of individual assessment and using data for individual children, because you want to think of the EDI more as a community snapshot of children's health, development, and school readiness. And it is providing that community snapshot DC-wide for your community. And the idea then is, rather than informing how to support an individual child, it's really how to support whole populations of children to inform place-based efforts to optimize healthy development for all children. So as a community, as service providers, as policymakers, to think about where children live and how that community, how the conditions in that community are supporting children, the EDI is really there to help inform those place-based efforts. And of course, as Darrell mentioned, there are school-level reports too, which provide a whole other kind of vantage point of the data to think about how to support children in school and as they move forward through the years. Because it's a snapshot taken during the pre-K4 time period, it's an ideal opportunity to do two things: to look at the EDI results from two vantage points. The first vantage point is to be able to look back. So now that you have this population level data on children at 4 years of age, you can look back to assess how the community as a whole has been able to support early childhood development and come together around strategies to improve that. Also, as a snapshot for 4-year-olds, it's an ideal point to then look forward and to think about how to then support that cohort of children as they move forward into kindergarten and through the school years. Next slide. Great. Oh, go back one, please. And we've talked about it being a community snapshot, which means it has a population focus. And in DC, what that means is that not only can we look at DC-wide how children are doing, but we're able to break that out by geography and by neighborhood. And so in DC's case, although there will be other ways to look at the data, initially we've looked at it by neighborhood cluster. And so this is a really important way to look at the geographic patterns, and you'll see a little later some maps that show the results by neighborhood cluster. So we talk about it as a population measure. We also think of it as a holistic measure because it's not just looking at children's basic literacy or numeracy, but it's looking at the whole child, and we're going to show you the domains, 5 broad developmental domains in a moment. As a National Support Center, we selected the EDI as a way to create some uniform way of thinking about children across the United States, and we carefully selected the tool. It was developed in Canada and Australia. It's used as their national indicator, and part of the reason that so many countries now have started to use it is that it has a strong basis in research, both for predictability and reliability, and so there's a large body of research that's accumulated over the last 15 plus years showing that this is a tool that it is a valid predictor for. If you measure this on children now as a 4-year-old population, it will predict how they will be doing later in 2nd, 3rd, 4th grade on standardized achievements tests. In DC's case, I mentioned it was administered this past school year on your pre-K4 population because you have nearly universal pre-K, and so it gives you a population level measure for that age group. As you know, most places in the U.S. don't have universal pre-K, and so more typically it's assessed on kindergarten-age children. The tool is valid for children 4 to 6 years old. And we're able to glean anonymous surveys on every teacher that fills out the EDI so that we can keep track of how they feel about the process. And overwhelmingly, our survey data shows that teachers feel that it's easy to use. And that's partly because it's an observational assessment based on recall. You get to know your children for 3 months, and then the children aren't even in the room when the teachers fill this out. It's based on recall. Once you get on a roll, it takes about 10 to 15 minutes, and it's completed online. Next slide. I mentioned it's a holistic tool. Here are the 5 broad domains that are measured by the EDI. There are about 104 individual items. Again, it takes 10 to 15 minutes to fill out, and it measures these 5 broad domains. Physical health, and then the sub-bullet gives you some examples of the subdomains that are measured within physical health, such as absence of disease, nutrition, gross and fine motor skills. It measures social competence, emotional maturity, language and cognitive development, and communication skills. Actually, over 2/3 of the items on the EDI come from the social and emotional domains. So that aspect of assessment is very strong on the EDI. Next slide. You can advance, thanks. The EDI, as I mentioned, teachers are filling it out online, and then the data is submitted through UCLA, and at UCLA is where we're able to clean and score the data and create a variety of reports and maps. And there are 3 basic types of output that we're providing back to OSSE and to the community. The first one we call the community profile results, and those are the results I mentioned earlier that display results neighborhood cluster by cluster. And because this is never showing individual results on a child or a teacher or a classroom, it's aggregated data. This is really considered public information by cluster, and it allows the whole community, parents included, policymakers, to look at this information. I'll skip down to the bottom part. We also provide the school reports, and I'll show you a template of that. And then we're providing a de-identified child-level data file back to OSSE, which is essentially, after we create all the reports and maps, there will be an ongoing need for more customized analysis and customized reports for communities who really want to take a deeper dive in the data. And so that child-level data file that goes back to OSSE is the mechanism for you all to continue to look at the data more deeply and in different ways. Next slide. I'll just take a quick pause because since you're on mute, I want to do a check-in with Darrell and Jocelyn. I don't know if there's anything in the chat room, or do people have questions, or should I just keep going?
There's no questions, but I'm unmuting.
Sorry, I lost your words, Darrell. What did you say?
No, I'm not showing anyone has any questions.
Oh. Does anybody have questions up to this point? Okay.
I would say
well,
raise your hand if you have a question, and we'll unmute you.
Great. And Darrell, just feel free to interrupt me if someone does raise their hand, so I'll slow down.
Okay.
Great. Well, what we have here is an example. It's the template for the school level report. And I think I mentioned we never report results by an individual child or by teacher or classroom. We want teachers to feel that and to know that there's no way that this data could be used to evaluate their performance. This is really a community level measure to inform place-based efforts. And so that's why the smallest level of aggregation that we would report on would be the school level, assuming that there's more than one classroom in that school or in that center. This template is designed to help the school or the center see how they're doing relative to the overall average of the school district as a whole. And so that's why on both the tables here, you'll see a set of columns for the results for that individual school, and then next to it, a set of columns for the overall average of the district. The first table on the left is really helping the school to see how some of its sociodemographic characteristics may differ from the overall average of the school district, which helps them see whether they might have a higher socioeconomic risk population or an average or lower risk group, which helps to put in context their EDI results, which is what's shown on the table on the right. And so a school could see what % of children are developmentally vulnerable in each of the 5 domains and what % of children are developmentally on track. And I'll give you a little bit better definitions for what that means in a minute. Next slide.
And Lisa, we actually have a question.
Oh, great.
So the question is it administered individually in order to understand a mixed community school's results? Are school polls from all 8 wards of this city?
So the first part of the question, I might need you to read the second in a minute, but okay. It is administered individually, and if I'm understanding the question correctly, teachers will fill out an EDI on each child. So in that sense, although the child doesn't have to be right in front of the teacher when she's filling it out, because the teacher's already had at least 3 months to get to know her children, so she can do this just based on a recall. But she would fill out an EDI on each child. Once it's submitted to UCLA, though, that's when we're aggregating it and only reporting it out on groups of children, either by school or by neighborhood cluster, et cetera. So the person who asked that question can let me know if I actually answered the question that was asked. But Darrell, can you let me know what the second part of the question was again?
And I was going to say, I actually unmuted. I believe it's Marquita. You're unmuted. So if you want to, you can actually ask your question to Lisa.
Right, because you keep talking about communities and neighborhoods. And so if our school pulls from all 8 wards of the city, how do you know where the kids live? I'm confused about that part.
Great question. Part of the process of filling out the EDI, before teachers fill out the EDI, each participating LEA, school or center, submits, actually OSSE generates a student roster and asks that LEA to verify the accuracy of that roster. That roster comes to UCLA and we upload it. And what's in that roster are some student demographics so that when the teacher logs in, he or she doesn't have to waste time filling out demographics, but also the child's home address, which we use to geocode to the neighborhood cluster that they live in. So that is how we're able to produce data that shows how children are doing where they live, as well as produce a school report that shows how children are doing within the school that they go to.
Thank you.
Great.
And we have one more question. One more question. On average, how long does it take to complete the EDI? I'm guessing they mean in regards to the assessment for the teacher.
Yeah, okay. Definitely the first one takes a good 30 minutes. So that's the longest one. Second one takes 20 minutes. Usually by the third one, people are down to 15. And the average time actually in our system overall, once teachers kind of get on a roll, is 10 to 15 minutes per child to fill out per EDI.
Okay. And Elena, I had unmuted you. Was that the question that you were answering? Did she answer it for you?
Yes, she did. Thank you so much.
Okay, you're welcome. I'll get to the next slide for you, Lisa.
Thanks. So let's see, roles for key partners. The first one's UCLA, and as I mentioned, because we're serving as a national support center, we mostly are providing train-the-trainer tools, technology, and coaching to the local lead, which in this case is OSSE. And then OSSE is committing significant staff resources and expertise to then support the individual LEAs and teachers. And so we, and as I mentioned, we also do the analysis, create reports, maps, and we're partnering with you and Raise DC in terms of already a significant effort to make sure the information is getting out there and to the right people to think about what to do with this, what the data means and what to do with it. Next slide. OSSE, being the local lead agency that we work most closely with, is working to provide this information to you, the local LEAs, to hopefully recruit and get as many schools and centers as possible to really enhance the robustness of this data. And so they're taking on the role of really on-the-ground coordination and also working with us to make sure we're defining the maps correctly and displaying the data correctly. And then they're taking a lead, of course, in convening early childhood partners around the use of the data. OSSE is also our lead partner in our National Shared Learning Network. So all the communities around the country who are doing the EDI, and we have about 65 cities that have participated so far, about 13 different states. And so we have a national learning network about how this data can support communities, and OSSE is a partner in that national network. The role for the LEA point of contact, of course, is once you've had your questions answered and you're interested, then would be to communicate and recruit your teachers so that they understand the value of this and how it's really not just another kind of assessment, but it's really thinking more upstream and getting them to, be excited about this, because of course the quality of the data is very dependent on how teachers feel about this. OSSE is also helping by generating the student rosters that I mentioned and asking the LEA then to verify those, and so that the LEA is really finally taking on that coordinating role with their teachers around the training and logistics. That's the main role there. And then for teachers, the commitment that's being asked of them is to attend a 1-hour orientation, to work with the LEA to send the parent letter home that OSSE provides, to complete an EDI on each child. Once that whole process is done for all children, to complete one very short anonymous evaluation form. And OSSE is supporting this for each teacher at the level of $200 as a $200 stipend. So I'll pause there in case there are any questions about the roles for the LEAs and teachers. Any hands go up there, Darrell?
No hands or any additional questions at this time.
Great. Okay, next slide. Of course, whenever we're collecting child-level data, even though it's not medical data, it's only reported in aggregate, we still have a comprehensive set of confidentiality protocols in place, and those are monitored by UCLA's Human Subjects Board, the Institutional Review Board, our IRB approval. The EDI does contain information about children's development and general demographics, but we don't collect their names. I did mention we collect addresses for the purposes of mapping children to the neighborhood cluster they live in, and then we strip out the addresses. And we never report on an individual child or teacher. The actual individual questionnaires, you can't retain them on an individual child level in a student's record, for instance. They're submitted to UCLA, so it's really only aggregate reports that anyone has access to. And it's not an intervention per se on a child. They're not present when this is filled out. So those are the kinds of protections we have in place for privacy and confidentiality, and it really is more of kind of a standard assessment for population and public health management as it is any kind of individual information being released to the public, which could never happen. Next slide. So OSSE and a large number of LEAs last school year completed the EDI, and so we do have some very good and important data available that we're going to share with you. I think the reason that we're implementing and hoping that additional LEAs will sign on this year is that not all LEAs, not all the schools and centers participated last year. And so what this means is that for a number of the neighborhood clusters, we haven't yet met the minimum threshold for participation, and so we're really hoping at a minimum in those clusters to get additional schools and centers. But also, even in the clusters where we may have met the minimum threshold, which is kind of a statistical calculation to identify how many schools or centers you would need in a given cluster, I know that OSSE and UCLA feel strongly that it's important to do more than the minimum, because the more schools that you can get to participate, the stronger the data, the more reliable the data, particularly because the idea with the EDI is to do this once every 3 years so that you could monitor population change over time. And when you start to do those statistics that look at change over time and whether it's statistically significant change happened from point 1 to point 2, you need to have a large N. You need to have large numbers of schools to increase the power and the robustness and the stability of the data. And so that's why OSSE, put this infrastructure in place last year and is willing to put the resources in to do this again this year, so that any schools or centers that didn't participate last year can participate this year, and we will combine the data from last year and this year so that come this July, the new snapshot that we create with all the maps will be a cumulative results from last year and this year and a much more comprehensive snapshot. So that's definitely my pitch for hoping that all of you on this call will join the effort, because although we have good data, it's really important to make it as representative and as stable as possible. So as I'm chattering on, maybe you looked at this slide. This is just some of the basic demographics from the data that we collected last year. There were over 100 schools that participated, over 300 classrooms. This did represent a little over 4,400 children. And you can see some of the other things. 14% were English language learners, 8% had IEPs. The race ethnicity breakdown somewhat mirrored overall population, although it's hard to find comparable data in the census. But this did lead stakeholders within DC to say, we got a pretty good representative the first time, but we do want to make it a little better. 67% of the children assessed last year are African American, 2% Asian, 15% Hispanic Latino, and 13% white. Next slide. So I'm going to go over some of the results, and I'll use 3 terms that I just wanted to define a little bit better. What do we mean when we say, 10% or X% of children are on track versus at risk versus vulnerable? So I'll start with vulnerable. When we talk about children who are vulnerable, those are children that without additional support and care may experience future challenges in school and in society. And children who are measured by the EDI who are found to be vulnerable do not do as well on standardized test scores later, and they've done the predictive validity studies to show that. Children who are found to be at risk on the EDI aren't vulnerable yet, so they're not quite there yet, which is a good thing, but they are lower than expected for that age range. They're considered at risk for becoming vulnerable. Children who are on track are meeting developmental milestones expected for this age group and are expected to be successful in later grades. I think I'll save some of the statistics for if there's time for questions in terms of we do norm this with population cutoffs as opposed to a criterion reference method, but I'll leave it at that. If we have time at the end and some of you like statistics or want to know about that, please ask. Next slide. So here are some of the results for District of Columbia, and we're comparing those results by domain and also to the national kindergarten averages. So keep in mind that the results that we're showing you on this slide are for DC pre-K4 children, 4-year-olds, versus the national results who are kindergarten age, tend to be a year older. And what you might notice is that for each domain, for instance, let's just look at physical health, the first one, and the very first bar, which is DC. The blue shows that 9% of children are vulnerable in physical health. The red is 14% are at risk, and 77% are on track. And what's really great to see is that that's really on par, very comparable to the national results, even though the national data has an older set of children. That's similar for social competence, and it's also similar for emotional maturity. The one that kind of jumps out here is the language and cognitive developmental domain, where you see that DC has a smaller percent of children who are on track for language and cognitive development. And I think what you'll see in a minute when we drill down to what's under the hood of that, when we look at the subdomains, you'll see that this is largely as a result of the fact that it's a younger population and some of the items really reflect more kindergarten standards. The last one is communication skills and general knowledge. And so there is always room for improvement. It's important to know what your baseline is so that over time you can try to improve that. Even if you're as good or better than the national average, you still want to optimize development for all children in your community. And so this is a really important baseline for each of these developmental domains to start thinking about how you can track improvement over time, and then really where to hone in terms of geography and subdomains, which we'll look at in a moment here. So next slide. So what we were looking at were domains, and now what we're going to look at are the subdomain results within each domain. So typically within each domain, you can break out the results into more granular results called subdomains, which is true for all the domains except for the last one, communication skills. This one, we're jumping right to the language and cognitive subdomain, and it's showing you that there are 4 subdomains: basic literacy skills. The second one is interest in literacy and numeracy, then advanced literacy skills, and the last one is basic. The green bar at the top is showing you the percent of children who are ready. So you want to see a lot of green. And if you were to ask yourself, well, what district-wide, what subdomain may need the most improvement, you can see that would be the third bar, which is the subdomain called advanced literacy skills. And actually, this is really what's driving the result that we saw on the previous slide, where it looked like DC was not doing as well on language and cognitive skills. And what's driving that really is this third subdomain called advanced literacy skills. Now let's look at the next slide, Darrell, and we'll help to dig a little deeper into that. So here are the items that fall under the advanced literacy skills. Advanced literacy, read simple words, read complex words. Now remember, this is done on pre-K4 students. Read simple sentences, interested in writing voluntarily, able to write simple words, able to write simple sentences. So what this really means is that these items actually reflect Common Core standards for kindergarten, not for pre-K4. And so that's why you're seeing a smaller percent of children being on track in DC than the overall national average. Advanced literacy skills are not those that we would necessarily expect of 4-year-old children. But what's interesting, and the reason that it's still important to report this, is that there are actually about half of children in DC who are meeting the standard for advanced literacy. So, you know, this is still a worthy data point to look at, because although we don't expect this of this age group, about half the children in DC are able to do these, are able to be on track in these advanced literacy skills. So when you're thinking about equity and trying to understand the range of developmental status across DC, I think there's still something to be learned from this data, not necessarily to be alarmed, but to learn from it. Next slide. We'll quickly go through these other subdomains. Here's the subdomain for physical health. And these are things you can look at more deeply after the webinar and hopefully talk to your team and staff about what it might mean. But the one that jumps out that has the smallest percent of children ready would be the third one, gross and fine motor skills. So that may be an area to focus in some schools or district-wide, depending on how it varies across school. Next slide. Here you have the subdomains for social competence. And overall social competence with peers tends to be an area that looks like there may be some room for improvement, as well as approaches to learning. Next slide. Emotional maturity, it's the pro-social and helping behavior, that first bar, that's the first subdomain that seems to have the most room for improvement. Next slide. Communication skills, this is the one that didn't have any subdomains, so it's just reporting it out as one. I will just say that the domains, when we calculate percentage of children vulnerable at the domain level, we use normative cutoffs. And when we calculate the percent of children ready in the subdomains, we're using criterion referenced. So they're kind of standalone results. You shouldn't necessarily try to compare domain results to subdomain results, and that's has more of a statistical answer, but I just wanted to highlight that in case any of you like statistics and want to save those questions for the end. Next slide. So we've been looking at graphs so far, but I think a lot of the power of using the EDI to inform change district-wide comes out when you start to look at the maps. And so we're doing, Josh Bader, he's been listening in carefully in case we have some mapping questions. We have a mapping team that take the data and map it. And this map actually is not showing the EDI results, but it's just reminding us all of how the neighborhood clusters are clustered into wards. And you have 8 wards, the Ward 1 being in the middle, and then kind of a spiral going clockwise out. So the yellow area is Ward 3, the green is Ward 4, etc. Down at the bottom right, you have Ward 7 and 8. So try to keep that in mind as we look at the EDI results on the following maps. And some of you are probably really familiar with the wards. We have a wide variety of maps, and I'm only going to show you a few of them to give you a sense of how we show the results, just to get familiar with this first map. You have a table on the left which shows each cluster, and we do have a key code that shows you the name of each cluster. I'm sorry it didn't fit on here, but if that helps you, we can be sure to get that to you. You can let Darrell know. But the table on the left will show, for instance, cluster 1 and what the actual percent of children vulnerable are. This map is looking at the percent of children who are vulnerable on one or more of the developmental domains. So it's not looking at a specific domain yet, but it's more of a cumulative measure of risk, looking at one or more. One thing to know is that the shading on all of our maps uses a protocol whereby the mid-range color of green represents the national average for all neighborhoods nationally. If a color is lighter, that means there's fewer percent of children vulnerable, but it also means it's a smaller percent than the national average, which is a good thing. If the shading for a given cluster is darker, it means it's a higher percent of children vulnerable, and it also means if it's higher than the middle range, it means that it's higher than the national average. So it's both giving you your local pattern, regardless of where you stand nationally, but also anything that's higher or lower than that middle range is also reflecting how you're doing relative to the national average, keeping in mind that that national average is kindergarten students. So this particular map, children vulnerable on one or more, the darker, there are some darker colored neighborhood clusters, darker green, that represent higher percents of vulnerability, scattered a little bit throughout the district, but you do see, I'd say, the majority of them in clusters 7 and 8, which some of that may be of not a surprise, but I think as some of your local policymakers are starting to look at this, there have been some neighborhoods that are surprising in terms of potentially having lower rates of poverty and higher rates of vulnerability. So they're not doing, so communities that you might expect to be doing really well aren't doing as well as you might expect. And conversely, some communities that are known to have high rates of poverty that are doing a little bit better on the EDI than you might expect. And that's driving some conversations about, what are the assets in this community that we can continue to support and maybe really try to spread elsewhere. So it's not always exactly what you'd expect, and I think that's where some of the gems of these maps are. The next slide is going to show a map of the percent of children who are vulnerable, I believe, in health. I think we can go on to that slide, yeah. The percent of children who are vulnerable on health. And as we saw in the very first bar graph, DC is doing pretty well and relative to the national average, and so that's why you're not seeing as much green here. But if you do want to look at the pattern overall, there's a little bit darker green in Ward 7 and 8, so you can just get a feel for the patterns. We'll go through these a little bit more quickly too. So Darrell, go on to the next one. Or it might not even be Darrell. I'm not sure who's actually pressing the button. Social competence. Sorry. This is a map showing the percent of children who are vulnerable in social competence. And again, very on par with national results, but with some variation. Clusters neighborhood cluster 3, I believe, seems to have the lightest green. This is where you kind of need to overlay your wards with a map like this so you can get a sense of which wards, but it does look like wards 7 and 8 have a number of neighborhood clusters that have room. Also, I just want to open it up. There may be some others from OSSE that would like to chime in on some key points in these maps. And also, I'm not sure if others have joined that want to introduce themselves.
Hi, yes, this is Elizabeth Burgin Ski, the Assistant Superintendent of Early Learning here at OSSE, and I just wanted to reiterate, while we're on the maps, you'll notice in some of the clusters, I want to reiterate a point Lisa made earlier, but some of the clusters have like a double asterisk next to them. You see it both on the map as well as in the column to the left. Those are clusters that did not have the level of saturation that we'd like to see for the data to be at a really robust, stable state. So that's why we feel like we have a good set of data, but we'd love to see, no asterisks in any of those clusters. Is that a grammatically correct sentence? I think we'd like to have higher saturation. So that's, I just wanted to point that out because that comes up in conversations and part of why we're encouraging as much as we can this year to get some more LEAs and then in another 2 years do a full citywide EDI again. Thank you.
That's great. Thanks. Yeah, and there are currently 7 neighborhood clusters that haven't met the minimum threshold. Those are neighborhood clusters 4, 11, 12, 13, 15, 20, and 22. And the rest have met the minimum, but some of them barely met the minimum. So, if you have an LEA serving even another cluster, it would be very helpful to have you join. And here we have emotional maturity, slightly different patterns on each map. And go ahead and go on to the next. And here's the language and cognitive development domain. And because DC's results had a higher percent of children vulnerable than the overall national average, that is why this map does have a lot darker green than the other domains. Some of the patterns are similar in terms of having a large number of neighborhood clusters with higher need in wards 7 and 8, but not exclusively. And you'll see in the next couple of maps, and you can go on, Darrell, that these are just a sample of maps. We, as well as locally, and you can go on one more, are able to zoom in so that you can get a more granular look at different wards or neighborhood clusters. And we're also able to overlay a variety of different kinds of data onto the EDI results, which help to kind of give you a better picture of the reasons why certain neighborhoods may be doing well or have additional need. And so we're always looking for other important indicators that we may want to overlay to help explain what we're seeing here. OSSE has identified a number of really great indicators for us to overlay, and there's still, other opportunities for more. This particular zoom in, we like to call it, again, it's that base map of children vulnerable on 1 or more, but we're zooming in towards 7, and we're also overlaying some of the assets. In this case, we're showing the rec centers, the parks, grocery stores, and libraries. And certainly, one thing that might be popping out for you, I think that there are only 2 grocery stores showing up in Ward 7, and these are the larger stores, not necessarily a smaller kind of mom and pop. But this could, be a really important finding, something to consider when thinking about how to support communities. Go ahead to the next slide. This is a zoom in of Ward 1 to help you get a better look at the neighborhoods, the neighborhood clusters within the ward, to also give you an idea of the other kinds of things that can be overlaid. In this case, we're looking at the child development centers and child care homes, along with the rec centers and parks. And from the OSSE team, if there are other observations about these that I should add, please feel free to chime in.
No, I mean, I think this is Elizabeth again. I think that these are just illustrative of opportunities and the power of the EDI data to overlay other data and to really be a platform for a broader conversation to happen in communities, to think about what it takes to make sure that children are ready and on track when they arrive at school, what the community needs are, how the community is, the conditions of the community. So I think this is where other people might find other assets that they would think would be beneficial, different communities that I had an opportunity to be in with this kind of data. People around the table could immediately speak to why the shades of green look differently because they really knew their community. And so it brings this kind of data to a more local level where we can get people to take action because they're more motivated, because it's their community, it's their children, the place that they feel connected to. So it's not just a data point, but actually something that relates to their everyday.
Yeah. Yeah, and it really is exciting to see that because we can look at the district-wide map, and certainly if you work at a district-wide level, a city-wide level, and you're a policymaker thinking about the overall district, those patterns are so important. But for any given community and any given group of parent stakeholders, regardless of where you are relative to other clusters, you care about improving things in your community. And so these zoom-in maps are really going to help you say, what can we do for children in our community? So it's both looking across clusters, but looking within all the clusters. And that's, I think, the power of the EDI as well, because when we talk about this being a population level measure, it's not just that we're reporting out on groups of children as opposed to individuals, but we're saying we want to improve things for all children. This is about optimizing for all children. And it's a unifying message. It's not just going back and always saying it's the same group that we want to focus on, but it's how can we support everyone. And it also keeps everyone engaged so that there's support for early childhood and not just, kind of targeted interventions, but really district-wide support. So for us, that's really a big value of when we say it's population, is that it's for everyone. Go to the next slide. Great. Timeline and next steps.
Okay.
Is this a piece? Go ahead.
Yeah. Yes, we can do that. Hi, everyone. My name is Jocelyn Sullivan, and we wanted to briefly go over what our timeline is for this implementation. As you can see on your screen, there are 6 major actions that need to take place in order for EDI to be fully implemented. The first is to contact me via email to let me know if you are interested. And
tomorrow.
Oh yes, right. Contact me tomorrow to let me know if you are interested in participating in this data collection, which we're hoping all of you are. Once that's done, we will do several things. I'll contact whoever your point of contact is at your school or LEA to go over the detailed items that we need to do, and then we would move forward into what's the next item on the timeline, which is coordinating the upload for your student rosters onto the UCLA portal. Once that's done, we will set train-the-trainer dates for the point of contact so that they have more information related to the EDI tool, how the assessment is done, so that if the teachers have any general questions, they would be there at the local level to assist. If you need support, they can always contact me. Then we will be sending out letters for you to give to the parents to inform them that their children that information will be gathered on their children. Their children are being assessed, but not in an individual child type assessment, but just so that they know that the teachers will be filling out information regarding their children. That has to be done.
Lisa, if you could just speak to that, the passive consent versus the families can say, no, we don't want our child, but they don't have to.
Right.
Did you already talk about that earlier?
No, we haven't.
We did. Sure. And that because even though an EDI is filled out on each child, the fact that it's reported out only on groups of children and it's used for population level change basically allows pretty much most institutional review boards, IRBs, to allow for this to be informational letter which is passive consent, as opposed to having to ask parents for signed consent. And so the opt-out option in the letter is, you know, this is what we're going to do. If you don't want it to happen, please contact this number, and it's a local number that's put on the letter.
Thank you.
Exactly, and that's why we ask that the parents receive the letters at least 1 week before the teachers begin the assessment, because we want to make sure that the parents have ample time to contact you or us to let us know whether or not they'd rather their child not be a part of the data collection. Once the POCs have been trained, we have the teachers trained on the assessment tools, the parents have been notified, and the rosters have been uploaded in the UCLA portal. We will then open the assessment window for teachers to be able to start inputting data on the children. And that will happen from the end of January through the end of March. So on March 31st at 11:59 p.m. Eastern Standard Time, the portal will close. We will not be able to collect any more data on the children.
11:59 West Coast time?
No, Eastern Standard.
Oh, Eastern Standard.
Yeah,
Okay.
Eastern Standard Time.
That is great. Thank you, Josh. This is Elizabeth again, and I know clearly this is not a lot of notice that you have to do tomorrow. I just want to speak to what we were able to do last year with 108 schools, public charter schools, 15 community-based organizations, and DCPS. We are here to support you, to individualize for what each of your needs are. So much of this can be done on the teacher's own time. They can look at the video and do the teacher training. So I just want to emphasize that while I do not want to underemphasize the fact that you all have a lot on your plate already, and there's not one more thing you need, and we appreciate you even considering this and being part of it. We are definitely here to support you and individualize what works for your LEA in your situation. And Jocelyn does a fantastic job of that. And we also have Eva Corcoran, who's on from our data assessment research team. She's on the call, and we can unmute her and she can say hello. She's the person who would be doing the rosters and helping with that verification as well. So definitely. Oh, she's not. Oh, she might have had to get up. Okay, so we have that support as well, but would love. And I don't know if there's a next.
Yeah, we do. We have the next step. Okay, so this is just the next 5 things that need to really be done within this next month, which is, if you are interested, identify someone at your LEA or school that would be the EDI point of contact that would work primarily with me. I will support you from everything from letters that you need, training materials, information questions you may have regarding the assessment to ensure that your teachers are able to do the assessments and complete them, by March 31st. The district profile that's listed on there, which is the part that Eva does. She is our data person here at OSSE. I would go into detail with you about what's a part of the roster. She will be the one that I would put you in contact with to submit it. In the past, it's been a data manager at the LEA that has worked with our data team to submit the roster, so it's generally not the person who is the POC or the person who talks with the teacher. Sometimes it's the same person, but generally it's split out depending on the LEA. Once we have that district profile, which is the big part, and we have it uploaded onto the system, things run pretty smoothly. I will set up training date times with you that work to show you all how the tool works, send you the information regarding teacher training, send you the teacher training link. Teachers can do the training on their own on the computer. It's about a 45-minute video that they watch. It's very self-explanatory, and
we can also have them. We can also do the training for them. We can invite them here to our computer lab or to our conference room. We can do that. I wanted to clarify, Jocelyn. Is the district profile? Do you mean that's the classroom roster?
The classroom roster.
Okay, so that's I think
separate.
So,
okay.
So number 3 is really classroom
roster.
Okay. Yeah. I wanted to clarify that.
and then we'll be able to begin the data collection, which we're hoping can start the end of this month. And so it might sound like a lot, but it really is not. And like Elizabeth said, we're willing to help you every step of the way. So we really hope that you join us and partner with us for collecting the rest of the data that we're looking for.
Yes, and it does take, we figured about 6 to 8 hours for a teacher to do a full classroom. That's why they're offering the $200.
Oh, I don't know why that is.
Because we know that you know, they may need to do this, you know, outside on their own time, and so we want to recognize and reimburse them for their giving us the knowledge that only they have about our young children in the district.
And Elizabeth, I don't know if there was anything you wanted to add in terms of how, I know that you're putting significant resources into developing tools and technical assistance to support schools once they receive their school level reports.
Yeah.
Because we do talk a lot about the community profile and using that, but there's also a real strong utility for the schools themselves and how you can support that.
Yeah, and that work is, we have our partners at Raise DC who are helping develop those materials, and we will do follow-up webinars on that as well, definitely to show, you know, to help and again provide the tools and the assistance to take this data and make meaning and take action. That's our most interesting, is to have the data be actually used to create, to take action. So I know we just have a few minutes. Do we have other questions? We're going to unmute everybody. So if you have questions or you're
I think like just
ask
having
that,
that start, or maybe a model of that, is a good starting point for some of our new work.
Everybody's unmuted right now.
Just understanding these are the kids who haven't met it. These kids who aren't growing, but additionally, I know he's in bed.
Always the danger of unmuting.
Whatever the factors are, but these are my.
Any questions?
Okay, so
Alina Roberts.
since there are no other questions, again, my name is Jocelyn Sullivan. If you are interested and would like to confirm participation for this data collection, please contact me. Here on the last slide is my phone number and email address, and I will be happy to work with you. Thank you.
Thank you. Thank you, Lisa.
Oh, my pleasure. Thanks, everyone.
Have a good day, everyone. Thank you for your time.